Welcome to the latest edition of Immunology Updates, covering breakthroughs in the past 2 weeks, brought to you by LucidQuest. EndoQuest Robotics reports the first fully robotic endoscopic submucosal dissection by a gastroenterologist within the Paradigm pivotal IDE trial in the United States. A Mayo Clinic, Arizona physician used the endoluminal surgical system to resect a complex 4 cm colorectal lesion, a descriptor, not an outcome. The multi-center study plans 50 subjects, signaling potential for streamlined initiation and follow-up at scale. In Korea, National Health Insurance will reimburse Bylvay, odevixibat, for patients with progressive familial intrahepatic cholestasis starting in October. The therapy addresses severe pruritus and liver damage in a very small patient population, which may enable oral disease management and reduce reliance on liver transplantation, according to clinical experts. Aera Therapeutics nominated Aera 109 as its first development candidate, a targeted in vivo CAR-T approach for B-cell mediated autoimmune diseases. Preclinical data presented at the CAR-TCR Summit showed targeted dose-dependent in vivo CAR-T generation with deep B-cell depletion in humanized mice and in non-human primates. The program uses targeted lipid nanoparticles for in vivo reprogramming, with clinical entry planned for mid-2026 per the company. The FDA-approved roflumilast cream 0.05% for children aged 2 to 5 years with mild to moderate atopic dermatitis. Supported by Integument PED and an open-label extension, the once-daily steroid-free cream showed rapid improvements in disease severity and itch with favorable tolerability, and the formulation avoids common sensitizers. Following a pre-BLA meeting, the FDA advised Biotech against an immediate BLA submission for cylembio after the Phase 3 IOB-013/KND18 study progression-free survival improved versus pembrolizumab monotherapy, but narrowly missed statistical significance. The company will seek further FDA guidance, consider a new registrational study, and explore a European pathway. The Nobel Prize in Physiology or Medicine was awarded to Brunko, Ramsdell and Sakaguchi for discoveries in regulatory T cells and FOXP3 that underpin peripheral tolerance. The recognition highlights more than 200 ongoing human Treg trials and the growing impact of tolerance-based therapies across autoimmunity and oncology. New results from the CARA Registry Stop JIA observational study followed about 300 children with polyarticular juvenile idiopathic arthritis over 3 years, comparing consensus treatment plans. Early combination therapy, a biologic plus methotrexate, was linked to more time in inactive disease versus a step-up approach, and very early starts within 2 months were favored. Celltrion announced the United States launch of Avtosma, tocilizumab ANO, as an intravenous biosimilar to Actemra. FDA approved in January 2025. It covers rheumatoid arthritis, giant cell arteritis, polyarticular and systemic juvenile idiopathic arthritis, COVID-19, and cytokine release syndrome, with multiple vial sizes and support programs. The addition strengthens Celltrion's U.S. immunology portfolio on the interleukin-6 pathway and introduces competition that may influence pricing and formulary access. Stay ahead in immunology research, like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.